when I landed on the ground, I didn't realize I was paralyzed yet. The guys put me on a helicopter, and the corpsman was shaking his head like this. And I said, "Is it really that bad?" He goes, "Yeah, this is bad."
To be able to walk our streets, have safe surroundings, it's just something that we think that we get. Some people can take that for granted. And you got to really think about how we have all those things and what it takes to protect all those things. So I think we have a duty to give back to the people that have risked so much to protect our country. In the way that we give back to the VA, building these projects, it's our way of giving back to the folks that have already given so much to us.
I have family members that have served in the military. We have veterans on our staff. I have teammates that, quite frankly, have paid the ultimate sacrifice in giving their lives for the country. So when I walk into these facilities, there is an absolute sense of pride in what we do. The Department of Veterans Affairs has been absolutely one of the best customers that the Walsh family has had in its 125-year history. The VA is the nation's largest healthcare system, employing 371,000 healthcare professionals across 172 medical centers, overseeing the delivery of care to more than 9 million enrolled veterans. So we're really proud of a 30-year history, 30 jobs, 30 years that we've had with the VA.
I have been with Walsh for 21 years, and my second project was a VA project. We've built all sorts of different product lines for the VA. Spinal cord injury center, polytrauma, inpatient, replacement hospitals, outpatient, you name it, that we've done with the VA. And having people in my family that are veterans, it just makes it that much more special for me.
As a group, we've done several spinal cord and rehabilitation institutes across the country. It has been fantastic to work with the VA and some of their consultants, like the Paralyzed Veterans of America.
People often wonder, why does Paralyzed Veterans of America have an architecture department? And I had to ask that question myself when I first became paralyzed. Well, Paralyzed Veterans of America is a national organization, and we're headquartered in Washington, D.C., but we have 32 chapters around the country. And when it comes to building a facility like this, it goes way beyond ADA. That's kind of where the PVA comes in. We know the accessibility part, and we know spinal cord injury really well. And these architects can put all these moving pieces together and come up with a kick-ass place like this.
To get firsthand knowledge of what works and what doesn't work, to get the opinion of the patients, the caregivers, the folks that are going to be using that facility every day is really powerful. Because all too often on a federal job, all we get is a pile of plans and a pile of specs, and we go to work. But it's really nice to be able to get some feedback from that, to understand what's important, what isn't, how the facility is going to work. It's really fantastic to be able to partner with a group like that to make sure that they get what they need.
We've been doing spinal cord injury for about 20 years. Across a lot of different geographies, we take care of spinal cord type facilities. They're a very unique construction. The requirements, when you think about somebody that's in a chair full time and what needs to look different in the building for those folks, it's a unique product type that we deliver.
It's not just a matter of stabilizing their spine and getting them into a wheelchair and getting them rehabilitated. Their goal is to make you be able to live and want to live on your own, independently.
I had a back injury in the military, so I know what we need when we're building these facilities, and it makes me feel good knowing that I'm going to help.
There's super specialized care that goes into the VA. Things like spinal cord injury and polytrauma. The VA is really leading in that, and they have a very specialized line of care, and the products that we put into place help them deliver that care. So those guys get to help refine the different guidelines and guide plates that the VA has. And we've made changes because of those mock-ups. And that will then take to the next job, and we'll learn how to build them better the next time. I think that's the value we can help bring, is because we are, kind of with the VA here for the long haul, we bring the lessons from the other projects to the next project.
We have 25 VA hospitals across the country that have spinal cord injury centers, and almost every one's been built with Walsh. It's because we've gotten to know each other, and we know there's that continuity of care, and there's that continuity of construction and quality.
Right now, we have a really special group of projects going on. We have the largest federal healthcare project going on at the VA in Louisville. A massive greenfield hospital site, complete replacement that is really taking a lot of our lessons learned from the past and leveraging them.
There are 2 parking garages, there is a new central plant, a laundry facility, and a host of other outbuildings. There is something for everyone on this one. Dallas is a long-term spinal cord injury center, so it's similar to the SCIs that we've done, but it's designed specifically for longer-term patients. San Diego is a combination of spinal cord injury center and community living center. So we'll be bringing 2 lines of care to the campus at San Diego.
In Long Beach, we've done mental health. In St. Louis, we did some mental health rehabilitation, as well as some administrative and some clinic space. Washington, we did seismic improvements.
Working on a VA campus is a very special thing. It is absolutely a community. And for the duration of the project, we become part of that community. Whether it's our superintendents or our project managers that are veterans, or the pipe fitters, the carpenters, the laborers that happen to be veterans, it is part of who we are. And it's exciting to become part of that fabric. I see it time and time again as I visit the jobs, just the pride.
We had this probably 30-foot by 50-foot American flag sharing between buildings the entire job. Jim Majors, our project superintendent, he's got a military background also, and he made sure that that was always represented. The significance of it, oh my gosh, I mean, I served under that flag for many years. People will see that, a little bit more respect, people have a little more pride, they do better work.
Serving those who serve, the veteran, that means an awful lot to me. These staff members here, these stakeholders, they're excited about this building being delivered, and we're excited about delivering it. So I get really, really happy about being here and knowing what this all means.
I've been working in VA projects now for the last 15 years. The care for the people that have returned from serving for our nation is a distinguished honor.
I was able to receive care at the VA Hospital San Diego. I could come here for care even though I wasn't retired. The VA hospital provides veterans with transportation, prescription benefits. A veteran has the opportunity to come here and get a meal in the chow hall, for Pete's sakes.
I truly believe that the work that this family has done over the past 30 years has changed the face of the Department of Veteran Affairs and how they care for our nation's veterans. We are really proud of how we've partnered with them. We are really proud of the work product that we've put in place, and we're really proud of what we've done for those who have served.
Paralyzed Veterans of America knows they can't do it all by themselves, and that's why we work with VA. We also work with Walsh. It's a great example of a public, private, and nonprofit sectors coming together to deliver quality care for the paralyzed veteran.
These buildings symbolize really our freedom. They symbolize that we are a great nation that will take care of those who have taken care of us. It's really a proud moment for us to be awarded one of these jobs. But you can never lose sight of the why, to serve those who have served. That's why we're here. We're here to help make a healing environment so that those who have served have a place that they can go and get well.